viewers, we have been joined by our final guest for tonight, the pediatric dentist, Dr. Sumant Mishra, who will be talking to us about the importance of oral hygiene. Good evening, Doctor.
Good evening.
It's a pleasure to have you with us again on HALA Kuwait.
Thank you very much, the HALA Kuwait channel and the management. Thanks a lot for always doing your oral health campaign.
Thank you so much. So, Doctor, today we're going to be talking also about kids, which is great, and their health awareness. So, can you talk to us about the importance of health awareness when it comes to oral health awareness for kids and even adults?
Yeah, if we talk about pediatric dentistry, being a pediatric dentist, child dentist, let me start by saying that our motto, we say, Auladak mithal auladi, like your kids is my child.
Yes.
So we treat each child as our own child. Talking about oral health awareness, still in many countries, the oral health is ignored and neglected, especially in the fast age. And I met many patients who say, Doctor, I don't have time to brush. As I was shocked.
Yeah.
So the mission is to make them aware about the oral health. Mouth forms the portal of entry, and digestion process starts right from the mouth, where there are a lot of digestive enzymes and saliva. Our oral health is healthy, and they can eat, chew the food properly. They can utilize the nutrition available in the food in a nice way. And that determines the general health, body health of a person. So it's very essential.
So I wanted to ask you about that. What is the association between the mouth and the general health? A lot of people don't know that these things are really connected to each other.
Exactly. This is a very interesting topic you raised right now, because people are really unaware about them, and especially in the corona times.
Yes.
We know that if there is associated comorbidities like heart, liver, kidney, respiratory, like lungs. So if they are compromised, then more chances of COVID-19, God forbid anybody having.
Course.
So a lot of research journals in, like, let's say American journals or British journals, they have found in their research works that there's association between the, let's say starting with the cardiovascular heart diseases. So if the oral health, especially gums, of the gums is compromised, then there is risk factors for cardiovascular heart diseases like heart attacks.
So a small issue with the gums could really lead to very serious problems.
Sure, people have to realize that gingival infection, inflammation of the gums lead to bacteremia. The bacteria flow through the blood to the heart, and then they might compromise the health of the heart. As well as research have found out in diabetes, it's both sides. So if the oral health is compromised, then uncontrolled diabetes. And if it's uncontrolled diabetes, it may lead to multiple oral abscesses, the dental abscesses or gum conditions, which is compromised. And respiratory diseases as well, which is very essential in COVID-19 duration.
Of course, since you mentioned COVID-19, can you talk to us about the oral health and hygiene during COVID-19? Did you find that a lot of parents came back with their children after lockdown with dental issues? Was that an issue after COVID-19 lockdown?
Yeah, exactly. Because during the lockdown times, we were only seeing emergency cases like abscess or swelling or extraction of the tooth, which needs urgent attention. And that's why it was a bit compromised, and they could not do the routine elective treatments. But when we opened up, slowly, now they're coming up, and they're coming up with other issues like fillings, restorations, and steel or crown, everything. So you are right, actually. They have started coming up, but they have come with a lot of pessimist thoughts, and maybe sometimes scared. The kids especially are scared to see us like in a different
masks
and everything.
Face shields, I'm guessing. So much gear just for that appointment.
Exactly. So parents' role here become very important, that they have to do the behavior shaping. It starts right from the home. The parents have to train the kids that they might see a different kind of dentist, not the dentist they used to see before. Now we are face masks and protective gears, as you rightly said, personal protective equipments, PPE kits, and also system of the center or the hospitals have changed. Like right in the front gate, we have trial system where there's temperature monitor.
That's
and then from there we distribute. Also in the waiting area, there is methane 2 meters gap. And
of course, COVID-19 has really changed the way, we even go to doctors. It's changed everything lately. What's the advice for parents you have regarding motivating their kids to keep their oral hygiene? I think that's a fight every parent has with their kid on a daily basis.
Lil Asif, unfortunately, parents are very busy. Nowadays, both parents are working and they find a bit challenging to spend quality times with their kids.
Yes.
And which is unfortunate for a kid, and I feel for them. And what I have realized after talking to the parents that they come only in the emergency when the kids start crying, and sometimes it's already reached the late stage. Even though we try to save the tooth, but it's a bit compromised when they come to us late. Okay, talking about the motivation from the parent side, the parents at home should be the role models for the kids, and till 5 to 6 years of age, till the time a child doesn't learn how to tie own shoelaces, they have to be supervised by the parents for their brushing. So the mom and dad should teach them the proper brushing techniques or supervise them and make it a habit, or make like 2-minute challenge.
Yes.
So 2-minute brushing with them, or like we talk about marathon, we talk about walkathon, but we should talk about brushathon.
Brushing your teeth longer.
Brushing in a group. So motivate them like that. Give some motivation stickers or some coloring books to motivate them so that the kids can be really motivated.
And Doctor, you have props with us today. Would you like to show maybe the viewers how their kids could be cleaning their teeth?
Yeah, this is interesting. Sometimes models can make it easy. So we have brushes. This is for the girls, like pink, and we have manual toothbrushes and we have electric toothbrushes for special needs or adults who are challenged for the brushing. And this is the model for the tooth. People keep asking about the brushing technique. Actually, American Dental Association recommends 2-minute brushing every day, twice daily with fluoride toothpaste. ADA recommends, American Dental Association recommends soft
for
bristles
children.
For everybody.
Okay.
So when we buy the toothbrushes, we should see soft, not hard, not medium. And technique becomes very important. So go at an angle and then gently round. And same we will do all the surfaces of the teeth. And also don't forget about the chewing surfaces at the back. Many of the sticky food items get lodged there and it's difficult to come out. Talking about the front one at the back, we have to make it perpendicular and up and down strokes. Same here. Also, it's not only about the tooth, it's also about the cleaning of the tongue. The tongue should not be forgotten. And see, between two teeth, the normal brushes doesn't go there. So we will use floss or we will use interdental brushes. These are brushes come in different colors and color codes depending on the spaces between the teeth. This is thin and this is more wide, you see, wider. So let's say interdental brushes work by placing them in between the teeth and then that cleans the food particles stuck between, which is not cleaned by the normal brushes. Or we can use floss. Cleaning the tongue, we have special tongue cleaners, or some of the toothbrushes at the back have striations, irregular surfaces.
Which is really important.
Exactly. Tongue can harbor a lot of bacteria, viruses, and may have some infections like candidal infections. So we have to be careful about brushing the tongue as well. And the food habits at home, the parents have to teach them the healthy food dietary habits. And reduce the frequency of sugary snacks.
That's really important to mention. Sugar, it's not a big deal. You can have it, but in smaller amounts.
The fizzy drinks, if they use with the food for the kids, it will dilute the effect. We cannot stop totally the kids.
Of course.
It's a bit challenging, but we can give them during the meal time. So with the meals, it will dilute the effect. And juices which good for the body but harmful for the teeth, this can be used, or the fizzy drinks with the straw, so it will go inside directly.
That's great advice, I think, the straw situation.
Exactly,
Okay, so let's move on to the updates in the field. What are the latest updates and what has changed lately?
Yeah, so as we talked about the restrictions during this coronavirus times, so when the patients go there, we have appointment systems to avoid zahma, too much crowd. And normally both mom dad used to come. Now we ask one of them to wait outside or maybe in the car, sayara.
Yes.
And then the moment they enter the center or the hospital, there is a triage system where the nurses actually take the temperature, monitoring of the temperature,
Yes.
to see if they're high or normal range. If there is high, we have to refer them to the unit where they need further investigations for
Yes.
COVID-19. If they're in the normal range, then they will go to the reception. The receptionist will not greet them with handshakes or anything. There is a
Right.
distance barrier or there is a barrier placed. Even the waiting area, there is a spaces. And when they enter the clinics, we have between two patients, 15 to 20 minutes gap, as per the suggestions of WHO, World Health Organization, as well as
Yes.
Kuwait Dental Association. So we have to follow the international authorities and also the local
Of
authorities.
course, and also that's just helpful to everyone's health, the doctors, the family. Right before we end this interview, do you have any final advice for the parents on how to make doctor visits easier for their children?
Yeah, the parents have to support us also. They have to understand the responsibilities of a pediatric dentist, child dentist, and they have to openly tell about the medical conditions of the child, because
Yes.
sometimes if they hide or they are not aware, they don't tell,
Yes.
then quality of health care, dental care suffers.
Right.
So the parents have to support us also.
Exactly. It's a big role they play, the parents, before getting to the doctor's office. Thank you so much, doctor, for this interview and all the advice you gave our viewers today.
Thank you very much. Thank
We had with us pediatric dentist Dr. Sumant Mishra. Dear viewers, we have reached the end of tonight's episode. I hope you enjoyed our various reports that always aim to keep you updated on the latest events here in Kuwait. And of course, our interview segments that majorly focus today on health awareness. Thank you for watching, and until we see you next time, have a wonderful evening and stay safe.